the serums of the obstructive coronary artery disease patients in Iraqi population for the study of Altahan 2015, and for the sclerotic heart patients in the Sweden population in the studies of Nystrom 2004. Our study also recorded low in iron levels among our patients in comparison to the normal subject, but it was not significantly. Iron level in sclerotic patients was found to be lower in the present study than those of iron value in each of the sclerotic heart valve patients in Sweden and in the study of Nystrom 2004. Also in the study of Gaziantep 2018 in the Poland population with heart failure disease, as well as in the obstructive coronary disease in Iraqi population for the study of Altahan 2050 sequentially. Moreover, the present study reported lower levels in serum of selenium between the patients group when compared to the healthy donors. So a similar pattern of decrease was found in the studies of each of Westermark 1977 in acute myocardial infarction patient in Finland, and in Salonin 1982 in the Finland population with coronary heart disease patient, as well as for Ozopi 1987 for the French patient with cardiomyopathy. So finally, the present study indicated that there were statistically significant correlation or between the zinc concentration in the patients with the aortic valve than those of non-aortic valve. So this agreed with the result of each of the study of Nystrom 2004 in sclerotic heart patient in Sweden, in COSAR 2005 in rheumatic heart disease patient in Turkish population, also for Turkish population with heart failure disease in the COSAR 2006 study, as well as for Altahan 2015 in the coronary artery disease patient in Iraqi population. All of them detected also lower significant decreases of zinc in their studies. So we can conclude from the previous slide that the present study indicated for first time that patients with aortic had twofold peroxynitrate level in their sera as compared to the normal range, and accumulation in the trace element in our sera was evaluated. So all recommended to the patient with aortic sclerosis in general, they should minimize the food which contain high amount of copper, for example, snow flour feeds and chocolate, red liver, and dried legumes, whereas those patients should take a high amount of zinc, iron, and selenium, and they should take the foods which contain high amount of iron, zinc, and selenium. For example, they should eat liver or red meat and extra. So patients with aortic had prevalence of obesity, diabetes, and hypertension, and at this point we recommend those patients to minimize their weight, at least by making a daily sport, and they should control their levels of hypertension and disease, at least to prevent the progression of the disease to more severe stages. Finally, this is the first attempt that indicated that serum peroxynitrate were markedly elevated in our patients, and it is helpfully diagnosed tool in the future. This is the reference which I used in my seminars. And finally, thank you.
Gençler çıkmayın. Hocam isim verirsen normalde
Hatta
çıkıyorlar.
bence de
Alsınlar. Daha iyi. Normalde şimdi biyoloji kısmında hemen çıkartıyorlar.
Yok, karar kısmında arkadaşlar.
Siz de uygun görürseniz sıkıntı yok.
Bence katılmaları.
Ya benim bir işim var, çıkmam lazım. Çünkü telefon geldi, telefonu meşgul attım. Bak.
Tamam.
Tamam. Kolay gelsin. Ben sadece şeyi merak ettim. O 40 hastaya çalışmışsınız da niye mesela kadın erkek eşit değil de kadınlar çoğunlukta? Sayın Hocam herhalde siz erkekler hasta mı, tesadüf mü, nasıl?
Tesadüf yani aslında aort sklerozu yaşla ilişkili.
Yani kadınlar mı daha çok yakalanıyor acaba diye
Yok.
düşündüm.
Yani tesadüf denk
Çoğunluğu
gelmiş.
kadın olacak.
Tesadüf gelmiş.
Korkmana gerek yok.
Ondan hiç şey değil. Bu genetiklerle biraz alakalı ondan korkmuyor da olanı niye özellikle? Kadın ve örnek sayısı niye 40 tutuldu?
Hocam aslında şimdi yaşa olan kapaklar dejenerasyona uğrar. Aort kapak daha çok dejenerasyon. Aslında bu skleroz dediğimiz bir dejenerasyon.
Evet,
Yaşa
evet.
bağlı dejenerasyon. romatizmal şeyler farklı. Yani
Mesela
içinde,
kalsiyum tetiklemesi çok şey geldi.
hocam hasar olduğu zaman, yüzeyli hasar, şiir stresli hasar olduğu zaman kalsiyum birikmesi çok doğal. Ya öyle bence çalışmada denk gelmiş.
Ha tamam. Yani
Yoksa-
ben de özellikle mi?
Hayır. Onu
İşi
o gender şeyin diferansını yapmaya kalkarsak hocam işin içinden çıkamaz.
Hayır, bir
Hasta
de-
bulma kısmında değil mi hocam?
Evet,
Hasta
hasta.
sayısı.
Çünkü hastalar seçiliyor.
Hayır bir de hangi mesela kırsal hasta mı, şehir hasta mı, niye kırık örnek açıkçası kafamda deli sorular oluştu hocam bu konuda.
Yok hocam yaşla ilgili bu.
Tamam siz
Yani-
yaşı baz aldınız.
Yaş tabii de yaşla ilgili.
Kırk
Çünkü
sayısı
Neyse o baza gelmedik biz hocam,
Hayır,
sıkıntı yok.
zaten biz etiye verirken
38
belli sayıyı da
sene.
söylüyoruz. Bu analiz yaparak. Bulunabilir, bulunamaz vesaire o kısımlardan dolayı. Geriye kalan hocam artık işte...
tabii yani eğer sizin dediğiniz gibi olsa istatistiksel olarak epidemiolojik bir çalışma
Sayı
olsa
yüksek olması
çok
lazım.
yüksek olması lazım.
Urban hastayla şehir hastası.
Ayırma-
Ben o anlamda dedim.
Polisi-
İlçe bazında mı?
Yok. Şimdi ya orada ben onun hatayı söyleyeceğim. O hata yanlış yapmış. Ben ona da kendisine söyledim. It's not a region study. It's not epidemiologic study. You don't need write any region name. Sweden, Finland, Irak. It's not necessary. Yani o bölgesi adları bir defa tamamen hata. Ben onları mesela şimdi yazıda hepsini çıkartıyorum çünkü bu bir çalışma, epidemiolojik çalışma değil. Bölgesel bir
Çünkü
çalışma
hani
değil.
biraz Gaziantep siz o
Hayır,
ülkeyi
o
kıyaslıyorsunuz.
prezentasyonu yanlış yapmış. O prezentasyon öyle değil. Yani biz bölge çalışması yapmadık. Bölge çalışması yapabilmemiz için çok farklı
Tabii bölgelerden
kıymetli almak
tabii
lazım.
farklı. O 7 bölgeyi baz
O
almak lazım.
bence prezentasyon
Anladım.
yanlışı, yazının yanlışı. O orada isimlerin hepsini ben çıkarttım zaten. İsim
Yoksa
olmaz.
emek verilmiş güzel.
Yok.
Emeğinize sağlık.
Yani
Elinize
o
sağlık.
yani isim yazmaya yani mesela Sweden, işte Finland, Irak böyle bir çalışma yok zaten. Böyle bir çalışma olması için binlerce hastayı almanız lazım. 40 tane hastayla
Onu baz
böyle
alamazsın,
alamazsın.
kıyaslayamazsın.
Aslında oradan çalışmanın oralardan yapıldığını söylemek için
Evet.
almış ama sanki itibar şey gibi olmuş hocam. Hani bu bölgeler
Hocam
karşılaştırdık.
şunu şöyle canım gitsem ben.
İşte bu yazmış.
sayı hocam sayı.
Sayın hocam 40 tane sayı olmaz.
Kolay gelsin hocam. İyi çalışmalar.
Gençlik kızlar bir sevocularla servis yaptık. Sonra devam ederiz. Sosyal
Şey
havasında
servise
devam
gerek
edeceğiz.
yok.
Böyle misin mesela şu
Hocam gerek yok alırız.
Hocam biz alırız ya.
Hatava yakın yere mi oturalım?
Hocam
Nasıl yapalım?
çocuklar siz geçin oturun biz alırız.
Hocam siz oturun ya arkadaşlar.
Ha oturun gel. Mehmet hocam ne
Gerek yok.
diyorsa?
Hocam gerek yok alırız.
Hocam
Hatalı şey yapalım.
yanınıza mı alalım? Şuraya mı alalım?
Hata orada kalsın.
Orada kalsın.
Tamam.
Orada.
Işıkları yakabilirsiniz arkadaşlar.
Ya.
Yani.
You can turn off the lights.
Bak.
Turn on the lights. Okay, it is the time of questions, Hatavi. We will discuss your thesis. Thank you again, congratulations. Yeah, of course, you will write it, you will make a publication for this thesis, possibly. So we will make some criticism about it, and maybe it can be a contribution to you for rewriting again or rethinking again about your hypothesis and to make a discussion about your publication. So we will start at the beginning first. My colleagues will ask the questions, of course I will ask, and then we will discuss the other parts of your thesis. Hocalarım buyurun isterseniz. Siz başlayın beraber aklımıza geldikçe sorarız.
Firstly, I want to explain your thesis, and it's not necessary. And again, I want to repeat again, it's not right region name, and because it's not epidemiologic study, and maybe you could choose ferritin instead of iron. Yani,
I will discuss it
Yeah.
now.
okay.
Yeah, okay. First, of course, the design of the thesis, you choose a selenium, zinc, iron, and copper. Okay, these have the antioxidant capacity to prevent the oxidation or damage of the heart valves. Okay, but you will find the normal. Normally, in the normal range of iron, cannot damage or cannot cause the damage of the heart valves. Okay, you cannot find any damage on the valves. But if the level of ferritin or ferritin level is high, then maybe you can find some contractile problems of hearts and also the damage of heart valves. So maybe it is logical to use the ferritin level in this study. Okay? It's much more logical to use it. And the second part, sorry. There is an important parameter in your study, alcohol and smoking. But here you cannot find, you didn't find any relation between the heart valve damage and between the alcohol and smoking. Is it okay? But if you check your thesis, the number of patients is low. So you cannot find any damage between heart valves and heart valve damage. Okay, no significant relation between the the peroxide levels and heart damage. In fact, the alcohol and smoking are the predisposition factors for the atherosclerosis and heart valve sclerosis, thickening of valves, and the distortion of the valves. But the number of patients is low, so maybe you can claim that our patients' number is low, so we did not find any relation between the alcohol and smoking. This is a suggestion to maybe to discuss in your publication that. Okay, it's the low number, because we know it's a classical result to alcohol and cigarettes is a result of atherosclerosis and damage. Okay, the diabetes is the most important reason for heart sclerosis, valve sclerosis. It is because of, what is the reason of it? It is because of the imbalance between the cholesterol level and the glucose level in the patients. So I think the most important part of this study, you should include the level of cholesterol, triglycerides, and also LDL and the other cholesterol subgroups. It's possible to find them in the computer, and respectively you can include them. Okay, it's enough now. Maybe you can ask some questions to the Hatabi.
Yani bir tek
Zaten yanındaydı. Şey yapmışsın.
yani hepsinden bildiğim için. Maybe only one, as you said, copper accumulation on tissue. This idea you find on histological or other methods, copper. You cannot say copper relationship between atherosclerosis and copper iron. You understand? Yani hocam mesela ben onu birkaç kez uyardım, yani söyledim. Yani bu hani eğer dokuda biriktiğini diyorsan histolojik çalışma yapmak lazım.
Ben yine uyarıyorum da tekrar yazıları azalt dedim, biraz dirençli. Tamam.
Evet. Şimdi hocam o kendi şeyi gibi düşünüyor. Ülkesindeki yani orada yaptığı zaman ki yani mesela aslında bana kalsaydı ben şuna söyleyeyim, hani dedim ki hiç eser elementleri katma. Çünkü eser elementlerle aslında bir işin içinden başından beri olduğum için eser elementlerle peroksinitrat arasında bir bağlantıyı bu yazıda kurmak zorundasın.
Of course, you should claim why did you search the level of selenium, zinc, iron, and copper.
So the
You
reason
should
why
explain that.
Why we choose these four elements?
Yeah, of course.
Since we researching and we wanted from the beginning to found our goal from the beginning to found a topic which were unique. So when we search about heart disease with the help by Dr. Murat, we found that atherosclerosis, the previous study, there is no applied to the antioxidant and free radical. So when we searching about these elements, we found that a lot of previous study which mentioned with the general disease in the body, we found that there are a lot of studies indicated a significant relation between these parameters and their disease. So we conducted to choose these four elements. Maybe they are also affected on the our patients, especially these are one part of the antioxidant. Unfortunately, if we have a lot of time, we will choose the other part of the antioxidant, which the enzymatic antioxidant, for example, glutathione, peroxidase, superoxide dismutase, and in this case, we will be sure 100% that our patients have a real strong relationship with the antioxidant and free radicals. So this is the reason why we choose these four elements. Researching, there is no previous study about it, just two studies, and this study they applied on the patients who changed their valve when they affected by aortic stenosis. So that's why we choose these four elements with the peroxidate and in aortic patients.
Do you believe the number of the patients is enough?
Actually,
for this study, to claim that Okay, zinc, selenium, and iron, copper, and are important trace elements, and prevents the oxidation of the heart walls.
Of course,
So
we
we
have
can
all-
we can include these trace elements in the treatment of the patients. Can you claim that now
no,
as a result of this study?
No, we cannot conduct 100%.
Because
say that
the
is-
number of patients is not enough. You should study much more patients.
We're waiting 4 months, which as we
Okay.
found was 40 patients. Unfortunately, in the university, in the Gaziantep University Hospital, as Dr. Murad knows, a lot of cases with this disease are registered in the Gaziantep University Hospital, but some of them or much of them are affected by other disease, for example, mitral stenosis and other valve disease. But our study was just on those patients who just have aortic sclerosis, so it was very difficult to find those patients. We waited 4 months until we got those 40 patients. So if we increases the number, maybe next year I'm going to graduate. So this was the reasons why we choose a little number of patients. We have these problems. We can take a lot of patients, but they have a lot of diseases, disorders, for example, mitral stenosis, especially coronary artery disease. So our study was just focused on the aortic sclerosis. So that's why we just focus on those patients that they have just aortic sclerosis.
Zaten tez olarak ben yayın olarak gönderirken zaten şeyi çıkartmak gerekiyor. Direkt olarak eser elementleri çıkartmak gerekiyorsa eser elementi yazdığın zaman direkt kafadan red. Ha ben abstrakt olarak öyle gönderdim ama hani kendi işine yaraması için. Ama yazıyı sadece hocam profesörün dedi biraz olarak. Çünkü hocam eser elementi soracağı soru şu. Niye o binlerce element varken niye bunları seçtin?
Evet, onu işte.
Yani sorun bu.
Bu kadar mı düşünüyorsun?
Evet, bu kadar param bu kadar diyemezsin yani. O yüzden ona biz de çok takılıyoruz hocam. Hocam o eser elementleri tamamen kaldırmak gerekiyor. Ona ilgili yazıyı kaldırmak lazım.
Belki de çıkabilir hocam. Biz hep içinde şey yaptığımız için kendisine çok şey yaptık. Canan hocam siz şey yapın, soru yine.
Okay, fine. I really like the thesis, and I know how much effort you have put to prepare this thesis and to do your study. So I would like to congratulate you and your supervisors to bring us such a nice thesis in front of us. I wonder of 2 things. First, could you please explain why zinc is related with these diseases?
So
We know the reason. So,
Significant.
of course, I agree with supervisors that the sample size is low.
No. Actually, there are several reasons for this. First of all, since we have accumulation of the copper, and as we know, the metabolism of copper is firstly affected on the metabolisms of the iron and of the zinc. So a lot of the recent study indicated that if we have a high accumulation of the copper, and this is related to much more reasons. For example, first one, the inflammatory process, and since this disease is a pure inflammatory problem, so we don't surprising that the levels of copper is high and the levels of the iron, of zinc and selenium is low, since these elements related firstly by the inflammatory problem. And the second thing is that maybe those patients don't take enough foods which contain high amount of zinc.
Because they are older people.
Yes, maybe
So.
this is also one. And the other reasons is that since a lot of our patients were from female, so of course the metabolisms of the female differences a lot of the times with the males. For example, maybe they have problems in each month, and maybe they take some drugs which they change their metabolism,
Yeah, sure.
and maybe they have problems also in the digestive process, which is generally affected on the metabolisms of these elements. So
Okay.
each of these elements are related to each other. If this one is high, of course it will be affected on the other ones, and especially if they take a little amount or a little quantity of these foods, so especially this one affected. Since also we have a low in the iron, and this is related to maybe those people, as you say, they are older people and they are elder,
chronic
so of
diseases,
course
so
they are don't care about their heart
fine.
or their health, so they also consume a tea and coffee, which affected negatively on the iron metabolism and finally affected on the other metabolisms of the other trace elements.
Okay, so fine. So then, are you confident with these elements in your study? So, do you think is it logical to include all these elements
No,
to compare, to
actually,
find the
if we
correlation
have a lot
between
of
these
time, of
diseases?
course, we are going to choose the other parts of the antioxidant. This is the one part of antioxidant, which they are non-enzymatic antioxidant. The other part of antioxidant is enzymatic, and if we have a time for this, if we had a time for doing this, for example, here superoxide dismutase, glutathione reductase. In this case, it was better for us to make a compare and to be sure that these elements or these antioxidant affected in 100% on this disease. So no, it is not enough actually, because we have a lot of trace elements and minerals and a lot of elements. So also for vitamins, if we have time, also we take a vitamins to be sure that these elements, each one affected on the others. So no, I think it was not enough. But since our time were restricted, and this is the main reason.
So what else would you do about or to further enrich these results?
For
What
future
kind of
work,
parameters? If you have got time and the money to do your research, what kind of
of course, I'm going to try
parameters you would
the
include?
test with the other second types with the antioxidants to be sure that, and also we are going to take some parameters with the free radicals, not just the antioxidants, since we just choose peroxynitrate, and this is really rare test, I think. So in the future, maybe we are going to increase the tests with antioxidant, the second type of the antioxidant, and maybe we are going to choose some tests or parameters which related to the free radical. For example, hydrogen peroxide is also important, and oxygen singulate in the body. In this case, if we choose all of the parts of the antioxidant and free radical, we will be sure that that there is a significant correlation between antioxidant, free radical, and this disease, and it will be a window for all of the researchers who come after us to working and searching about antioxidant and free radical, and will be a positive point for the company, since this disease there is no effective medical treatment, just the only solution is by valve replacement. So it will be very good for the company to at least to prepare a drug for that.
Okay, so let's say you get money and you get time and you've got patients. What is the optimal number of patients to conduct
Maybe
such a
100,
study?
100 maybe it will be good. Yes, because we just focus on the aortic sclerosis patients, as I mentioned previously. If we found other diseases, complicated disease, we found 200%. As Dr. Murat said, in the university we had a lot of the patients registered every year, but since we are focused, so maybe it will be more difficult if we choose specific aortic sclerosis. So maybe 100 to